Hey, Health Board, it's TSD. I have some people on the attendees list that would like to be promoted. If you could go ahead and let me know in the chat if you would like me to do so. Thank you very much.
350, been on the call. Did they not hear you?
We heard you, Stephen. I don't think we're getting any audio from the conference room right now.
Okay, can you hear now?
Yep, we can hear you.
Perfect, thank you.
That's Steve. So on the screen on the upper left is Kay Leach, who's also on the board, and Steve Pritchard, who just went away. That's also on the board. So we have a number of guests here today, so I wanted to make sure everybody got introduced. All right, so now we'll call public comment. Who is here for public comment? Okay, to remind anyone who wants to make comments, you get 3 minutes. And I promise you, I will cut you off at 3 minutes, just because we do have to get done. And if you have questions, that's fine. We may or may not answer them afterwards, but we may answer them in the course of the meeting. Okay, who wants to go first? You want to go first? Yeah, just stand up here and introduce yourself. Sure. Thank you.
Should we put a chair at the end of the table?
No, they can stand there.
Up here. All right, we have it on my phone. My name is Andrea Ford. I am from Bloomington and have spent most of my life here. I wanted to come here today because I know that there are things being discussed at the state level. And they clearly affect every community throughout Indiana. And the things being discussed at the state level are quite concerning. And I was at the state last week and testified at SB4. And it was clear that the senators were completely unaware of Governor Holcomb's Public Health Commission and their meetings that they hold. And these are the people voting on what happens throughout all the local communities and counties. So there's a video, you can see public video of Governor Holcomb's Health Commission. And there was a meeting from June of 2022. And in this meeting, the commission is sitting around a table and they're active. I don't know, have any of you seen that video? And they're actively talking about coercing counties into opting into this new restructuring that they're coming up with, where counties are going to accept funding in order to opt in to this new program. And in this discussion, the committee is talking about they don't want any counties to opt out. It is very clear that they want every county in this, which is a centralized public health at that point, when every county is under the same umbrella. So we're looking at centralizing the public health throughout the state, which is a very scary matter. And I'm not going to go into the details. I think we can all, kind of see where that could lead. But they're taking baby steps to get to that point. And there are comments from that. So Dr. Halverson made a comment about how, there were several comments. So we've got, Senator Kinley talking about how people want to play games. Counties might want to play, he literally says, play games. And, keep autonomy, how silly that is. And so this committee is coming up with ways to make sure that that can't happen. And that eventually, even if counties do opt out, that they're eventually going to basically be forced to opt in because the state is going to withhold funding. So one of the things that Dr. Halverson came up with was, well, let's go ahead and increase what is required by the county. And then they're going to have to take our money. But they're not going to be able to self-sustain. They're going to have to opt into this. So Dr. Box sits there and says, yeah, that's a good thing.
Just wrap up.
Okay, a good goal to reach. And so it is to increase our requirements per county, and then everybody has to opt in. Well, now SB4 comes in. And it's directly showing that this is what they're doing. So SB4 is at this point in time saying that only counties that opt in have to sustain these increased requirements. I haven't asked any of my questions. But anyways, so the SB4 is at this current time an opt-in. All right, but we all know what they do.
Okay,
Now,
you want to email us your question?
I will email you my
Thank you.
questions, yes.
That'd be great.
So I just want to make sure that SB4 and this Public Health Commission are being paid very close attention to. And I would love to see Monroe County be prepared to say, no, we're not going to opt into this program.
Okay, thank you, Andrea. Please tell me your questions.
I will, thank you.
Hi, I'm Ananya Maini. So I have a bunch of questions based off of, whatever we were discussing for SB4. My first question is, if you read SB4, could you also see how it would impact the Monroe County Health Department overall? Like, what would that affect? What would be needed of you to kind of be on the state line, so as to say, And the second question is, they want us to increase services at the health department. And, you know, what I want to know, what kind of services is Monroe County Health Department already offering? And what's going to be the increase in those services? Like what more would be added in those services, if at all?
Are you saying if we got funding from the state, how that would
Correct.
change? Okay.
Correct. What would be those increase in that services that the Monroe County would be adopting? And are you prepared to turn down the funding to avoid losing autonomy in this process? Like, that's one of the, that's the kind of question that I think the board needs to address to the citizens. And and also, like, do you have any other kind of rebuttals, so as like people who are opposed to SB4, like what can be, what's your stance, like why people should be opposed or should not be opposed? What's the Monroe County Health Commission's kind of remarks on those? So those are my 4 questions.
Okay. Again, we can't answer this because we actually haven't discussed this as a board yet, but we will.
Okay.
Okay. All right, thank
So
you.
we can expect some answer probably next time.
We'll have to get to there. Yeah, we are going to discuss it. And we'll figure out where we're going with it. Did you have any other questions that?
No, I just wondered moving forward since it's in its.
You're gonna talk, yes,
infancy
I'm here.
stage. Oh, thank you, Karen Fulkerson. Are you going to be like including public meetings or education on this or sharing information through the newspaper, or how are we going to
I mean,
understand? what's
before we
taking-
decided the money or after? What are you
Well,
talking about?
just maybe during the process.
Okay, so
How do we have access to that information during the process?
are we going to get input from the public during the process of deciding whether to
Right.
take the money or not?
Right,
Okay,
thank you.
thank you. Okay. Anybody else? Okay, thank you for your questions. And like I said, we as a board have not discussed this yet, but we will. Okay. And we obviously need a lot more information before we're ready to take a stance on that. All right. Public health reports, Zara.
Yes. Do you need me to stand?
Yeah, you can stay right there.
Okay, sounds good. Yes, hi, I'm Zara Partita, the interim manager for the Monroe County Public Health Clinic over on Miller Drive. Things are going well at our clinic. We are nothing major to report. RSV numbers are down, flu numbers are down in the county. Less than 5 TB cases, no current monkeypox cases, so things are going good. No current outbreaks also. While things are slower, we are still seeing a good amount of people for COVID boosters. Very little flu vaccines, but they still come in those stragglers. And with that being said, we are able to get anybody that's needing an immunization appointment into our clinic within the next 1 or 2 business days. So nothing too major to report, but things are going well.
What a change.
That's for sure.
Yes, well, that's great.
Q4 was crazy.
A lot of people
Okay.
are getting their flus in various other places.
Yes.
Pharmacies.
Q4 of 2022, we saw in just Q4, we saw about 2,000 people just at our clinic. That includes all immunizations, but a large amount of those were flu.
Well, that's when they should have been getting it.
Exactly. Yes, thank you.
Does anybody else have any questions for Zara? No, hearing none. Thank you so much and welcome.
Thank you, I appreciate it.
And now we have Lori's report, which isn't going to be so fast.
Oh, right, no, it's not going to be as quick.
You only have 3 minutes.
Only 3
You
minutes, I
get
can
more
do
than,
it.
you get more than 3 minutes.
Okay.
Oh, wait, I messed up. I skipped approval of the previous meeting minutes. It's so hard to get good help, isn't it? Yeah. So we got the minutes in our packet and do you have any changes or things, anybody? I'm sure you all read
They
it.
look fine.
Yeah, they look fine to me too. So I
Shall I
understand.
move to approve?
Do what?
Shall I move to approve?
Please.
I move to approve.
And George seconds and all in favor. And we have to do this vote because we have 2 people on. There, I'm gonna start with you guys. Kay, we're voting to approve the minutes.
Am I allowed to vote by video conference? I thought we weren't allowed to vote if we were on video.
what?
But you
What?
couldn't vote.
You're allowed to vote as long as a quorum of the members present are in person, so she could
That's what
vote.
I thought, yeah, okay.
Okay,
Yes, you're allowed to vote.
yes.
Steve? And Steve may be, can you hear Steve? Yes, okay, Bob,
Yes.
Don,
Yes.
George,
Yes.
Sarah,
Same.
and I also vote yes. Okay, so we've approved the minutes. Now I'm back on track.
Okay,
Now you can,
ready?
okay.
Okay. All right, so for administration updates, start with our staffing updates for vital records. Kathy Hertz is the registrar. Eric Diamond has began as the assistant registrar. Environmental health. Mike Kuzmaka is the new environmental services manager, Kuzemka. Cheyenne Cox has moved to the senior environmental health services wastewater sanitarian position. Aaron Agley started as the environmental health services wastewater sanitarian. And Matthew Britzman has accepted the position of temporary environmental specialist, planning a start date of February 27th. The Futures Clinic, Peggy Ryan has been moved to a part-time status, so she's working in the clinic on Tuesdays and Thursdays. We are currently working on getting telehealth up and going to provide services on Mondays and Wednesdays. Fridays is a half day for their administrative time. Emma Rice has accepted the position of nurse practitioner, officially beginning April 3rd.
What was your name again?
Emma Rice.
Okay.
Mhm. Candidate for the LPN position just recently accepted the offer, and we have her scheduled to begin on February 27th. And the community health specialist, tobacco educator position was just posted this week.
Okay. Any questions about, so basically this, other than the tobacco educator, everything's filled at this point.
Everything is filled except for the tobacco educator.
Okay, and where are we with the telehealth? Are we,
Well, so we, the individual who was helping us with that has had to take a bereavement leave. So we're expecting another 2 weeks to be able to start coordinating to work with that individual to see which partner clinic we can begin working with. But so we have the equipment, we have Peggy has the certification. We just need to finish working out the details with the partner clinic that we will be working with. I have a workflow chart set up and designed so that the individual answering the phone can go through a workflow to determine which clients will and will not qualify for telehealth services, to be able to kind of map that out to say whether they could actually schedule with us. So in the process.
so how's it going in the meantime in terms of being able to see patients? Is it, are they backed up at all, or are they?
They're staying busy on Tuesdays and Thursdays,
Okay.
but the clinic is still open, so individuals can still come in and get their birth control pills or schedule for services or ask questions. But she's staying busy, particularly since there's not been an LPN. But everybody down there has been working very well, helping to just help one another out, answering the phones, cleaning the rooms, running the tests. So we are moving along.
There's a good group down there.
Yes.
Yeah.
How long have you been looking for actively looking for a partner clinic?
What?
Oh, for the telehealth services?
Yes.
Well, telehealth was supposed to be implemented in 2021. I currently have just started looking and getting this going with the new clinic manager within the past couple, I think it's been about 6 weeks. So.
And is there someone assigned specifically to locate a partner clinic? And do you have a date by which you want to have that partner clinic up and running?
Oh, well, so we have to use the partner clinic that is guided by our grant funder. So Indiana Family Health Council provides who that partner provider will be. And so we've been thinking that it's going to be someone with the Indianapolis location or Bedford. but we have not been able to reconnect with the individual who's going to help us get that going until she returns from leave.
So she's with the Family Health Council people.
Yes,
Oh, so
Yes.
yeah, we're pretty much tied to their grant.
yes.
Okay, thank you.
So it's one of the joys of grant funding.
Yes.
Okay, any other questions about any of that? Okay. What's next on your list?
Okay, so for division updates, the first quarterly staff meeting was held on January 3rd. Monthly section meetings began the first Friday of February. This will continue monthly through the remainder of the year. We are currently working on updating job descriptions. We will be providing these to the board to review within the next few weeks prior to the next board meeting. For vital records, Jessica Waters provided a huge thank you to the entire group for working well together, especially during the busy time of the year that they're processing all of the annual permits. That vital records group is working together to develop process improvement ideas and SMART goals for their section. With public health preparedness, our school liaison is completing trainings in asthma education and tobacco education to receive certification to be able to provide educational trainings within the area schools and different organizations. We have two local schools scheduled for CPR and Stop the Bleed training with our school liaison. And schools are currently submitting their project proposals for the grant funding that we've received in this new round of funding. And once we receive all of those projects, we will then determine how to divide that money up, basically depending on how many schools are going to participate. For the Futures Clinic, they are working on beginning a Google appointment text reminder system. The system is free to use, and we hope to be able to reduce the amount of no-shows in the clinic by using this tool. In January, there are 65 patients scheduled, 45 actual visits, and 20 no-shows. So the no-show volume has increased, and we are hoping that using the text reminder system, we'll be able to get that number lowered.
Yeah, that's always a problem in public health. When I did well baby clinics, we'd have a 50% no show rate until we started calling them all the day before. I mean, you're familiar with that. Yeah, that's just and in the winter it gets worse because it's cold.
Share what resource you use, 'cause we're looking into what's called bookings.
Oh,
Microsoft,
mhm.
just an FYI.
Oh, okay. So Google appointment is a text reminder. So it's a free app-based, yeah, you can get on there. So that's what.
Yeah,
I think it's start
Problem.
using that.
in every public health clinic I've ever been involved with.
Yeah.
So
Let's see, the first 2023 advisory board meeting is scheduled for March for Futures. And the quarterly report goal of increasing adolescent visits has been exceeded.
I have a question about that advisory
Mhm.
board, because I used to be on it, and I
Mhm.
thought that you were on it. Are you still on it?
I haven't been invited for several months.
Yeah, so we need to make sure that we have a
Okay.
board member that's on there.
Okay.
And are you willing to do it still?
I would like to, sure.
Yeah.
Okay.
Because I just think it's really good to have a board member on that advisory board, and I think that, again, lots of things kind of fell apart during COVID.
Mhm,
And it's time to get everything back on track.
mhm.
So I think that's what I want to make sure that there's a board member that goes to those meetings,
Sure.
and Bob's the person, and being a OBGYN, he was the perfect person for it.
Okay, great.
So, so I would make sure that, and then again, changes,
Mhm. Yes,
those,
we'll
we
do
can get
that.
that back on track, that'd be great. Sorry to interrupt you, but
No, you're
I
fine.
forget things if I don't say them right away.
Circling back to telehealth, the clinic manager is planning to shadow a nearby clinic to review their telehealth process, just to make sure that we're kind of in line with what we're thinking and how we're going to implement it.
That's great.
Other than that, the last update for Futures, an inventory list has been compiled of all of the grant-owned versus county-owned items. So that's been a really big task, but that inventory list is completed and down in the clinic.
I also heard that, who's the person, an employee that worked on recovering all the billings that hadn't been done?
Oh, no.
The clinic manager, yes.
And that's
Eric.
spectacular.
Yes, he has done an amazing job. He has worked extremely hard, has caught all of the billing back up. Claims are now being submitted on a weekly basis. They are all up to date. Unfortunately, there were claims that had to be written off because they had exceeded the date to be submitted, but everything is up to date. And $23,000 in November, we were able to get reimbursed. That was all a backlog. So we are moving right along with that. It's really great news.
That's spectacular. What's his name again?
Eric,
The
Yes.
billing firm.
he's great.
Was here before she got it. She found it and got this started, hired the guy that's doing it. He's doing a great job.
Give Eric, sir. Erica, thanks.
Yes, he's great.
Okay.
Okay,
And do you guys have any questions about various things at this point?
teachers.
You're all good? Okay.
Let's see. Oh, and the Path for You project. So we are still getting that up and going. That's the funding. So we are going to be setting our first meeting after the new LPN starts to begin getting that program established and up and going. So,
Okay.
disease intervention
I
specialist.
actually have one more question
Yeah.
about environmental health.
Mhm.
For a while, there was some backlog because of turnover and that kind of stuff. How are we doing with that now?
So we are very good with foods. Foods is up to date and has actually surpassed where they were as of January last year. We are up to date. Let's see.
Jessica was quite proud of her list. We had a list of 600 or something she sent out. It was some
Yeah.
outrageous number. It was
Yeah.
a lot of work.
So let's see, real estate inspection, septic applications and complaints are all up to date. We currently do have active septic install work orders, but these are all on hold, waiting for septic installer reports and documents before our staff can go in and complete the work and move forward. This is the same with pending complaint follow-up. So there are still some pending there, but they're simply waiting on the documentation and installer reports to be able to go back out and get those finished up.
Okay,
So, yes.
that's good.
Excuse me, Lori, did we
Yes.
skip over the disease intervention?
That's
Yes,
good.
we did.
What?
well,
She was
no,
getting-
just
she was
'cause
getting
I-
ready to do it.
Yeah.
but I interrupted her.
Sorry.
My bad.
Nope, you're fine. Okay. Let's see. So staff have increased their testing in the Vigo County Jail. They are spending more time working out of the Terre Haute location for Positive Link. So currently we have 2 staff members who are transitioning back and forth between working out of this office here and the Terre Haute office with Positive Link. There have been increased caseloads of syphilis and HIV in the Western District, which is the Terre Haute region. Staff are working with the state to establish health fairs and conferences. The state is now asking that we follow up on all gonorrhea cases. There were around 1,000 cases last year. Yes.
You can continue.
Oh.
I just need to ask
Oh,
some questions at the end
okay.
of that.
Staff do plan to primarily complete these via phone interviews just because of the high volume for this requirement.
Okay, clarification. They're asking for a full-on interview / investigation rather than just treatment confirmation on 100% of gonorrhea cases.
Yes,
Are they giving you 20 additional DIS?
well, that's kind of what we need, but no, and unfortunately, this round of grant funding has decreased a little bit, so we're a little bit tighter on the funding. We definitely can't afford to get any more staff with that, so that's why the current staff that we do have are just trying to get those completed during the phone interviews.
And do you know, is this, they have a special grant for supplemental gonorrhea interviews. Is this a requirement of the state by CDC for their supplemental gonorrhea funding?
I do not know if it's a requirement for that supplemental funding. That is something I would have to check with that division about, or whether the state is just,
I guess I'm curious
Asking
for the
them
reason
to-
for this. Kathy, would you know? Does
Mhm.
anybody
What?
know?
I don't know if it's part of the supplemental. I know that they are planning on putting more GIS out at other organizations. That's what they knew with the new grant. So it is connected to that.
Okay, thank you. Okay. Any other questions about? Yeah. Okay. Can move on to general environmental. So we have had many staff members give a lot of praise and kudos to Cody for updating the access database system. Simeon has been able to collect all of the complaints out of the NERV system into a PDF format. There were 1,171 of these that are going to be printed for hard copy and then uploaded electronically. Staff have been attending lead training this week. They did pick up the XRF machine and they are doing some training, practicing, getting some samples for that.
So we're actually doing this, the leads here?
Out of this office, yes.
Wow.
Yes, so
That's
that's
good.
something new with the new lead grant that we have. So we have the machine now. We're going to be working with the public health clinic to set up standard operating procedures for the nursing staff with the environmental staff when they go out to do the assessments.
So, so these samples are, what are these samples coming from? The one, so,
Wall, like paint.
okay,
Mhm.
so you're not doing screening for, of kids? Nothing.
Our side will handle the people side.
Okay, so because here's what, I think the pediatricians do screening, no problem. Because they see kids like all the time. I think some of these smaller family practice type offices, I don't know what IU Health is doing. I don't know if you work with them at all in terms, I'm just concerned about some of the kids that, I mean, if they're seen by, you know, the pediatricians group, that's not an issue.
Right,
But there's kids seen in other offices as well,
right.
who
So-
probably don't have the, you know, the ability to do lead screening. And I think this is an important thing for them to know about, that they can,
Right,
that they can send, so I think you need to
yes.
connect with them.
And we have started sharing, the nurse that handles our lead cases at our clinic has started putting together media pieces, flyers, things that we're sending out to the schools. Something I didn't share is that March 11th, we're doing that's a Saturday, we're doing a kindergarten focused vaccine clinic at Miller Drive.
Yeah.
Alongside, we are offering lead testing to anyone that stops by. But further information will be shared to all the schools,
Right.
indicating that anyone that doesn't have a primary care physician at the PEDS office.
Oh, I'd suggest you contact the medical society.
Okay.
Dave Burnworth is
Can you repeat those?
Dave Burnworth is the director there at this point. Monroe County Medical Society is the name of it.
We just had a board meeting last night.
Did you? But this is, they have a newsletter and they have the ability to communicate with all the physicians pretty easily. So I think that's information that about this would be a really good thing to get out to those through there, and Dave can help you with that, I think.
And I believe Sally reached out for a contact list for maybe some daycares here in Monroe County, that sort of thing.
Yeah.
So the ball is rolling. So-
Be gentle with them. The AT&T is extremely slow, he said, so getting all this stuff out maybe, he's
Yeah.
not happy with AT&T right now.
I can do that. So,
Yes, so educational brochures, there's radio advertising that is going to be starting next week. That gives the public health clinic information as well as a phone number that can be called for more information about that testing that we'll be doing. Let's see, year-round pool inspections are being completed and wrapped up, and staff are planning to attend a vector control conference in March. For our wastewater division, they are hosting a statewide septic installers meeting at the courthouse in March. Our new staff member began training in the field this week. It's going well. As mentioned earlier, real estate inspections, septic applications and complaints are all up to date. And we are looking into, we are working with Jackson County to compare their real estate inspection process to the service that we are actually providing, to compare whether we could adjust how we're doing ours to be able to help relieve some of the time constraints that's
currently being used by our staff. So we are working with them. For foods, they have completed a presentation at United Way. 611 annual license renewals have been sent out and around 300 have been returned. 75 inspections were completed in January. We opened 10 facilities and responded to 10 complaints. Inspection reports for December of 2022 are now on the Health Department website. We are working on long-term solutions to be able to provide these reports on an ongoing basis, either through OpenGov or an app-based system. That's pretty much what I have for environmental.
Any questions about environmental health from anybody? Okay,
Population health and outreach. We give a lot of praise to Melanie for her hard work on the criminal justice response survey presentation that was prepared and given at the courthouse recently. The CHIP groups are forming plans and action items at this time. And Linnea is working on a survey for health equity. COVID-19 updates. XBB 1.5 is still this primary circulating variant, around 60% of cases in the US. The vaccine is still providing protection. Rapid tests still should be detecting positive rates. Monroe County is still in the low COVID-19 community level. As of January 26th, the FDA announced that Epishield is not currently authorized for emergency use in the United States. This was found to be ineffective against the majority of current circulating variants. The Health Department does have a large amount of free COVID tests that we're trying to get distributed throughout the community and the individuals can pick up. We have thousands that are set to expire on February 28th that we've been trying to get distributed to the shelters and other organizations for use. And the FDA is now encouraging people to report the results of their home test via a website that's been developed by the National Institute of Health.
really?
Mhm.
I have nothing, anyone know about that? Has anybody heard of that?
I think it just came about.
I just saw it yesterday.
Mhm.
It's fantastic.
Okay, I never heard of that.
So here, yes,
Interesting.
so.
Huh.
Just in an effort to be
Kinda
able
random.
to have that data.
I'm sorry. It's a random data collection.
Yeah.
Okay.
I think that's all I have.
Yeah. I'm trying to figure out what that what information could be done with that, which is probably nothing. Okay. All right, and now. Do we have someone here from the Friends of Lake Monroe? That's Maggie Sullivan, right?
Yes.
Maggie.
Well, let me just say briefly, she has a very complicated job, as you can hear from that, and there are so many loose ends that need to be kept track of. Lori's done a great job of trying to put it all together, and it's a real accomplishment to have full staff. We had like 85 applicants for the job for one of the jobs, and then 20 more on her cell phone.
Yeah, actually, sorry, Maggie, but I actually have a question for, I forgot to, in the packet was a prenatal care grant mid-year report. And I'm confused by the mid-year part, being as it's February.
Mhm.
Is this a fiscally, and the numbers just, this doesn't make sense to me. Does it make sense to you?
Well, so I reached out for an update back in the fall of last year of 2022.
Okay,
And so when I reached back out here just recently, that was the report that I had received for
Yeah, because it says like 19% of the 2022 grant has been used. It's 2023 now, so I'm a little confused.
Mhm.
So,
Fiscal year. Fiscal year.
Well, it would have started,
I
the
mean-
new round would have started in January.
yeah, I mean, are they on a fiscal year and we're not? I mean, I know we're not, but are
Mhm.
they on a different year or something? Because this report makes no sense to me.
Mhm. Yes, that's something that I need to meet with that individual to get further clarification and information on,
Yeah, because
because that
as
funding
budget
does
comes
start
up
each
here, yeah,
year.
as we have budget coming up here in a few months and
Yes.
this, from this report, it sounds like they don't really need the money,
Mhm.
which is, I don't think that's their intention. I would guess.
Mhm.
Yeah, it's just, okay, so, yeah, so we need, that needs to be clarified. That's, did that make, if it makes sense to anybody else? It just didn't make sense to me. And anyway, so we'll follow up on that then.
Yes.
Okay, great. Now, Maggie. What happened to Maggie? There's Maggie, okay. So this is the Friends of Lake.
Thank you for having me. So my name is Maggie Sullivan. I am the Lake Monroe Watershed Coordinator, and I'm just going to run real quickly through some things we've been working on. I am sure you are all familiar with Lake Monroe. It's our sole source of drinking water, a recreational destination, home for wildlife, and it's also used for flood control. Friends of Lake Monroe has just published a watershed management plan. Actually, I guess it's been about a year now. And this is a document that has a clear plan of action for addressing water quality goals. It identifies the problems and proposes the solutions. And like the name says, it looks at Lake Monroe, but also at its watershed. And watershed is the area of land that drains into a particular water body. So this is a map of the Lake Monroe watershed. It's about 440 square miles. So it's about a quarter of Monroe County, about half of it's in Brown County, about a quarter is in Jackson County. You'll notice Bloomington, by and large, is not in the watershed. So we get our drinking water from the lake, but our land does not drain into the lake. The watershed is important because basically anything that's on the ground has the potential of getting washed into the lake. So that can be things like oil from cars, that could be animal manure or leaking septic systems. That can even just be soil itself or fertilizer. All those things have the potential of getting into streams and then flowing into Lake Monroe. We took a lot of water quality samples, did some analysis, and concluded that the top issues for Lake Monroe are sediment, nutrients, and E. coli, which is an indicator of fecal contamination. When we look at sediment, there's a lot of potential sources: stream bank erosion, lakeshore erosion, areas with heavy livestock use or conventional tillage, areas that are cleared for development or during timber harvest. Basically anywhere the soil is exposed, it has a potential to get into our waterways. Nutrients can be carried with the sediment. They can also come from any kind of manure, whether that's animal manure or human manure. And then of course from fertilizer, whether that's on cropland, that's on people's homes, or that's on commercial properties. E. coli, we like to joke, can come from Bessie, Bambi, or Bobby. We are most concerned about Bessie, the livestock, or Bobby, the leaking septic system. We did a survey of streams, and about 20% of the stream crossings we observed had livestock present. And based on septic system records, we think there's about 9,000 of them in the watershed, about 3,000 of those within Monroe County. So our watershed management plan has an action plan component that basically says, how are we going to address these sources of pollution? Our goal is to keep the pollution out of the lake and out of the streams. And to do that, we want to change land use practices, change some individual behavior, and then implement projects that will protect water quality. Our focus is on voluntary adoption, so educating people and providing incentives for those changes. So some specific examples for farms, that's things like fencing your cows out of the stream, putting in heavy use area protection where the animals gather. For cropland, that's no-till agriculture, that's planting cover crops in the winter, and that's putting a buffer between cropland and streams. And those riparian buffers are most important next to ag land, but really everywhere. It's great to have thick permanent vegetation that'll provide some filtration before water runs off the land into the stream. And in the case of trees, it also provides shade, which lowers the temperature and increases available oxygen in the water. Another thing to look at is stabilizing the lake shore and stream bank. If you guys have been out on the lake, you've probably seen some areas that are not so pretty. The challenge is there's 103 miles of shoreline on the lake and hundreds more miles of stream bank. So this is not something we can do everywhere, but select areas that can make a big difference. And then septic system failure. We don't have super accurate records of where systems are failing, but we know there are some, and we know the ways to avoid it are to help people remember to maintain their septic systems, figure out some funding for repairs when failed systems are identified, and thinking about places that the sewer expansion can happen to get more people onto the collective sewer systems. Really, a lot of what we come down to is education. So helping people understand how they can make a difference, whether they're homeowners, they're farmers, they're foresters, they are just recreational users, everybody can play a role. So in order to implement this watershed management plan that we developed, we really need community support. We need partners who are engaged and working on the problems, and we need to do things that will address stakeholder concerns. So we've started by what we called our Community Action Initiative, and this is what we've been working on for about the past year, basically promoting the plan, making sure that people know that we've done this work and what it says and how they can get involved, educating about water quality issues. And then we launched a pilot septic system maintenance cost share program in Monroe County last year. So we held a lot of community forums in Bloomington, Nashville, and a virtual forum. And we had about 60 participants. We told them about the plan and we asked them to help us brainstorm how do we get people engaged. And we got some really good feedback from those events. We also had a watershed summit, and that brought together 27 organizations throughout the watershed, talked about the plan, and helped talk about who could help with what and how should we prioritize the activities in there. Ryan Cushman from the health department was able to join us for that event, and that was great. We are still working on a final report that we'll be sending out shortly, kind of summarizing everything that was discussed. And then this septic maintenance voucher program. So we did a direct mailing to about 3,000 Monroe County households saying, hey, you can get 50% off the cost of pumping your septic tank. We had about 78 households took us up on that. It was 50% reimbursement up to $100 if they just pumped their tank, or $150 if they pumped it and added a riser. We had 3 households who did put in risers, which was great to see. But most people were just pumping their tank, so we ended up reimbursing between $70 and $100. We also did a educational program, a virtual program. Cheyenne Cox from the health department gave a really great presentation and answered questions. We had about 30 people participate, which I thought was pretty good for an online workshop just about septic systems. We also posted that recording online, and we took some of that material to used it to develop a brochure that we handed out at the fair last year and are continuing to circulate. So here we are now moving on to our next project. This is funded through a 319 grant from the Indiana Department of Environmental Management. It's a 2.5-year program, about $300,000 in value. The big piece of it is a cost share program for some of those best management practices, mostly on farmland, but also on forest land. And then we're doing a lot of education. So we're doing agricultural field days, forestry workshops, septic workshops, sending out mailers, doing boat tours. And we're hoping to partner with the health department again on doing at least one septic workshop. So again, in order to promote that septic system maintenance, we're hoping to do one workshop in each of the 3 main counties of the watershed, sending out an educational mailer that if we can get the timing down, we can promote that educational event with the mailer. But if not, we can still share information both ways. And then we'll continue to be educating about septic system maintenance when we table at events. So long term, we're continuing to build and maintain partnerships with other organizations. And as we identify projects, we're looking for funding, trying to get those going. Again, keeping our community members engaged and of course, educate, educate, educate. So I know I just threw a ton of information at you, but I just wanted to try and bring you up to speed on what Friends of Lake Monroe has been working on for the last 3 years, and hopefully partner with you on some septic education moving forward. Thank you.
Thank you. Great presentation. A lot of work you guys are doing. Does anybody have any questions? I actually have a couple. You talk about the cost sharing funding for your maintaining septic systems and the vouchers for pumping your system. Where's this funding coming from?
That one we applied for and received a grant from the Community Foundation of Monroe County. We had some additional funding from Monroe County Stormwater. And that was for the whole package that included the septic vouchers, doing the community forums, doing the watershed summit, printing more copies of the watershed plan to distribute.
Okay, and do you still, I'm assuming you still have ongoing communications with Shai and about the. you're
Yeah,
still- Okay,
we don't talk a lot, but I've been keeping her in the loop as we start to plan things.
okay. Then did she attend that summit in the summit in October?
I think it was just Ryan that came.
Okay. Okay, are you planning another summit or anything in the future, or what's your plan?
We definitely want to do one, probably not this year, maybe in the next couple of years. We'll bring everyone back together. Our goal moving forward from the Watershed Summit is more doing smaller follow-up meetings with different groups. So for example, we've worked with the Department of Natural Resources on identifying the projects that are most important to them and what are the next steps there. So I know I'm hoping to work with Cheyenne on this septic workshop. And, if that leads to discussions about other potential projects, I'd be happy to keep moving forward on that.
Okay. Go ahead, George.
Maggie, George Hageman, are you doing anything about interacting with folks over at IU about things like toxigenic algae and climate change and its influence on the lake?
Yes, IU is a big place, so we are working with certain aspects. We actually partnered with the IU Limnology Lab, did a lot of our sampling and analysis as part of developing the watershed management plan. We've talked a little bit with the Environmental Resilience Institute. We've talked with some individual professors who are working on projects that tie into what we do. So I didn't get into it, but the big concern with nutrients is that they stimulate those harmful algal blooms. And that is one of the top concerns we have for the lake. Because even when they don't produce toxins, which so far in Lake Monroe, there have not been toxin issues like there are in some other lakes. But I think we can all remember that taste in the water last summer when we had those high algae counts and they could get the water safe to drink, but they couldn't get that taste out. So, we also have a close partnership with City of Bloomington Utilities, and they're doing a lot of great stuff. They actually have some new algae monitoring equipment that's pretty exciting. But our focus is on improving the source water, and their focus is on treatment options once, with whatever water they have.
Good, thanks.
Yes, thank you. You've done a lot of great work. So what can a health department do at this point to help you?
So I never know whether I should be going to the staff or the board, so I want to make sure everybody's on the same page, but our big focus now is just education. I'll be working a lot with farmers, but we definitely want to do some septic education that we'd love to partner with you on. And then if you have projects that you're thinking about that relate to water quality in the lake, we would love to collaborate.
What do we need to connect with anyone else, do you think, in the department, or?
Definitely with Shai and then
Yeah.
Aaron now, for
Yeah.
sure.
Yeah, we have a new wastewater person, so his name's Aaron. Aaron?
Yes.
Aaron.
Mhm.
So that might be someone you might want to connect with as well. But yeah, that's the best, I think the best thing to do is work with the wastewater people, right?
Definitely. Yes.
What else can we do?
I think that's it for now. We're just trying to get the word out, so thank you for listening.
We appreciate all the hard work you're doing. Those of us who drink the water, yes, we definitely appreciate it.
We all need that clean water.
Yeah, well, clean water is the most important public health effort that we've ever had. Immunization is second, by the way, but clean water is first, so. Okay. Any more questions for Maggie? Thanks for coming, Maggie.
Thank you.
Thank you.
Okay. And now we have some other things.
Kathy.
Yeah, I know we added some things there. Okay. I got next we're going to talk about let's do old business. I have one more thing about old business, by the way. And that's actually for Kathy. Since you're here. Last time we talked a little bit about the e-cigarettes, and can you tell us where we are with that?
Sure. Just as a reminder, we're working with IU Health, Community Health, to look at trying to get adding e-cigarettes to the county no smoking order. So right now, we have a survey up on the hospital's website and on our website as well out on Facebook to ask people what their perceptions are about the risk of e-cigarettes, both to themselves and to others, and to ask them if they would support adding the e-cigarettes to the county ordinance. So once we've gathered enough information, we can analyze that and then share that with the commissioners and go from there.
Okay, great. Let's just keep that on the old business thing until we actually
Okay.
solve this issue.
Okay.
That'd be great. Thanks, Kathy. And next, we want to talk about the strategic plan survey results.
Okay. We don't have the survey. We're working on the survey right now. It's long. I'll have this around if you want to look at it. I would like to get it shorter. So what this is based on is, if you remember when we did the strategic plan several years ago, there are some actions that the board wanted to do too. So this is the beginning of this. And what it is implement a survey within 2 health department services that helps identify practices that may contribute to racism, ethnic disparities, and health inequities. So it's our job to create the survey, but once we get the survey results back, then we want to share them with you and assist you in creating a report to analyze what we can do better with it, with our staff and our practices, so that we can better serve our community. So like, we're working on the survey right now, and then we'll get it to staff. It will be anonymous for putting like the divisions together to agree. So they are in general job duties, not exact divisions, so that they will be anonymous, but we'll have a rough indication of the sections kind of that they work for, so that we can better have a context of what their answers might be.
Thank you. That's good. I think, yeah, now that we're coming off COVID, within luck. I think one thing we need to look at is exactly what you're doing with our strategic plan and see. I mean, a lot of stuff got put on the back burner the last 2 or 3 years, so it's time to kind of recircle back around to what our
Exactly.
basic jobs were here before COVID. And,
Exactly. This is
yeah,
only
there was a life before COVID. And we needed to probably look at that strategic plan and try to focus on some of the things that we've let slide in the last couple of years. Thank you so much for doing that. Okay.
Can I ask a question? And so the survey is just for staff?
right. This is just that. We're just focusing on how we can improve our services so that they're more, that we can build more health equity and be more culturally competent in serving our residents.
Okay,
So it's mainly based on the national standards of basement class. National class certified standards. And that stands for culturally and linguistically appropriate services, which is short. The national standards, we also added some other questions, so we can further narrow it down exactly on what steps or actions we should take.
Yeah, we did a big strategic plan thing. When was that? 3, 4, 5 years ago? I don't know when it was.
just,
The second one we did in 2020. We did one before that in 2016.
Yeah, we did big.
I was at the summit, but I guess I'm wondering, after you've checked out with staff, then will you also be looking at how the public views those same criteria? And
This was just based on what our staff, we hadn't planned to go further. We can all, after we get the results, if the board wants to look at further steps, we absolutely can.
Yeah, this is an internal strategic plan. One of the things that, and the board was involved with strategic plan, one of the things we identified as being an issue, which you all know is equity issues among various populations. And as one of the things we needed to work on. And we made a couple things that Kathy mentioned in terms of goals. And so what she's trying to do is talk to the staff to see what they think they can do, and then we'll bring that to us to help us make goals for things for us to do as a department, basically.
And increasing equity within health departments is a huge public health goal right now. So it's, we're going to be building it into all of our processes and policies going forward.
As it should be, because there's huge health disparities. So,
Absolutely.
so, okay.
Thank you, Kathy.
Pardon me?
Thank you, Kathy.
Yes, Kathy, great, yeah. Since the public health funding thing was mentioned, I think we might want to discuss that a little bit. I don't know, we might, I think all of us probably need to look into that a little more. the problem here, I mean, I've not read I read House Bill 4, which kind of was frightening, for various reasons. Not, and, I've read part of the governor's, and, I've been reading that along. I think counties like ours, where we do function fairly well, we have a good, strong health department. Aren't, you know, are not the target, from what I can tell. The target are the smaller health departments who, you know, like, Owen County has 3 people working in Owen County. Some of the smaller health departments really do need help in terms of how they function. And I think this is an attempt to deal with that. I personally have not read enough stuff. I don't feel comfortable forming an opinion at this point based on what I know. Unless some of you guys have read more about this than I have.
I just, while we were here, I sent the bill to Lori. And I think maybe our first question for ourselves is how do we educate ourselves sufficiently so that we can have
Right,
a discussion?
exactly. And how do we do that? What do you have any suggestions on?
Not at all.
Oh,
I need to read the bill.
yeah,
That'll be my personal first step.
yeah.
Carol, this is Kay, and I have
Hey,
a
Kay.
question. I did watch the videos last night, both of
Oh,
them.
good.
And one of the things that said in the video is that a couple of members, I think Dr. Box and one of the senators, I think they said they had visited Bloomington 2 times. And I think they said it was with the county council. And I just wonder if anybody from the health department was invited to those meetings.
No. No, I was not. From my understanding, ultimately, this decision rests on the county commissioners and the county council. I have attended a meeting in Indianapolis with at the State House where they were just generally talking about these. I've attended some online meetings, but I have not attended any meetings that they have come here to speak with the council about.
Can I jump in? Because there was a scheduling conflict, so I filled in for her. I did watch one of the
So-
online ones.
Yeah.
It was the one that they talked with IU, the hospital. So I observed that one. So I
So
did,
they really haven't involved their health department at all.
No.
We have heard a lot from the state itself, from Camp Antonas, we have bi-weekly meetings where they talked about it for mostly a month. So
Yeah,
it's our internal working. group.
okay. So what do we need to do? We need, first of all, maybe we could get, I mean, I've gotten links, maybe through Andrew. I think it's through you, I got the links. Yeah, I think I got the, did you put a link to the Senate bill in your, yeah,
The Senate, I'm not sure how
Anyway.
to Senate bill I sent
or maybe I may have gotten it from,
the
reading.
whole video and then a couple of
Yeah.
minutes and then a brief overview, yeah.
Yeah, so I think we should all try to read the Senate bill.
I think what we will also do is maybe concise everything in one pager kind of thing, so it's gonna be easier for everybody on the board. Sorry.
We welcome input in terms of anything you can
So-
tell us that because you all have obviously studied it a lot more than we have.
I
Right.
think it's sure you relate the Senate bill to what the commission's goal truly is, because Senate Bill 4, it doesn't look as intrusive as it could potentially be by the end, because they amend and they do all the
Right.
things before.
Yeah,
And so Senate Bill 4, it's a step, and you can directly see the relation to what Dr. Halverson mentioned in the video, in the commission meeting from June. And Dr. Box is in full agreement that this is basically our ultimate goal.
yeah,
So I think looking at the two, and then seeing where they connect.
I think also the board needs to probably see what the intention of those videos were.
okay. Yeah, so please, what I'd like y'all to do is, and obviously the less words, the better for most of us. If you could summarize you know, what you know, and then I'm gonna read the bill. I've read the bill, but I read it very quickly, because I was actually looking at the health officer part. I was looking for something very specific in the bill. And, what else? What other?
So if I could add to that, and I do believe it was off of the information that you had sent, because Jamie and I did watch that together earlier today, but it looked like somewhere in that information, there was a list of questions saying health departments should be addressing these questions and looking at to be able to gather that information. A lot of it was based off of the funding. How much funding do we currently have? How much, for example, are we operating based upon grant funding, which is huge within this department? Because if the state is saying that if you do not opt into this, you are no longer going to get those grant funds, we're going to pull that money away from you. Essentially, that would be taking probably half of the staff that we have now. Nearly. So I think those list of questions would be a really good starting point too. Something that Jamie and I identified to be able to start getting those figures to see how that impacts us here.
Yeah, that's why those questions that I posted, what are the services that you're already offering versus what
Mhm.
was gonna go away? What is the thing? Again, we need to ask the question, if the money was coming in, and if it's just, you know, marginalized percentage of what the entire budget is, the county needs to make a decision whether you really want to opt in or opt out.
Yeah.
But it needs to be recognized that as the bill stands at this current moment, that extra funding and those extra requirements only come if you opt in, right? So that's as it stands right now, but the whole point of it is that their ultimate goal is for every county to have those extra services, whether you opt in or not. In intent that it's gonna force every county to.
But in that video, wasn't there discussion in that video wherein people at the table asked, what about the counties who don't participate? And there was some discussion loosely about giving them a 1-year window to opt back in as an option potentially. And there was some discussion, I thought I heard some discussion about additional services
That's, yeah.
that
so
would
that's what
be
this is.
added.
Yeah.
So I think the key is that as the bill stands right now, it doesn't seem like people are gonna be forced to opt in. But if you watch the Health Commission's goal, it is to build it to where that is where it will stand in the future, is that there will be no choice anymore. And I want to point out, I mean, I feel like that it's already been kind of made obvious that, I mean, that's already happened because you guys haven't been pulled into the meetings already. So I don't know. I'm just throwing that in because that's what I've witnessed with your discussion right here. But this state is grasping for more control. And that's what we need to be aware of.
Yeah, but the problem is they're dangling a humongous carrot.
Exactly.
It's talking like 80% versus 20%. So the county provides 20%, they provide 8%. We're talking about a huge amount of
And
funding.
some counties don't take any funding, like Jackson County, somebody was talking about Jackson County. I don't think Jackson County takes any funding from the state as it stands, but,
It's a very small county.
right.
And
So-
if they increase service requirements, that's what was on that video.
Then they will
was a
have no choice,
discussion
right?
Yeah,
to force
right.
people into it.
Yeah.
But as Senate Bill 4 stands right now, that, like, I think if you, like, some of the senators are like, but this is an opt-in program. As it stands right now, that is true. But that's not where it will be, and
So-
that's not the Health Commission's goal.
Right, so,
But it's
so what we need,
designed to force county
Yeah.
or coerce county so as to you.
right. Okay, so what we need to do is,
I just have to say, you know, there's language is important. You can say coerce or you can say incentivize, and it's a very different, policy is often incentivized
yeah,
rather
That's
than
why
being
I
coerced.
right.
And
We need to look at the intention.
Yeah.
when you're trying to identify the ultimate goal, which is better public health, kind of hard to argue that that's a bad goal.
Yeah, it's a mixed thing. So what I think we need to do, and tell me, I want input from the rest of the board here too. Is I think we need to look into this a little more. I think we need to get feedback from you as you get it, because you all are the ones that attend the meetings and. And if we need to, I don't know that we need to make a statement as a board right now. Anybody feel the need to say anything?
I'm very concerned that a lot of discussions going on in the health department's not been involved in it. And I think that what I got from it was they don't feel that's necessary. They're going to the elected officials and so forth. And, you know, trying to pitch this program, and they will be the ones that will decide. So it seems to me that one of the things that we're going to need to do is try to reach out to those people, the elected officials and so forth, and maybe try to educate them once we figure out how this is going to affect us.
Yeah, but just like Don said, it's hard to turn down huge amounts, and we're talking about a lot of money here, a huge amount of.
$150
funding is-
million, I think I heard.
$150 million.
Yeah, it's a lot of money. Well, so maybe you can just keep the board updated as to how things are progressing, which I think is important for us. And then probably you could read the bill and just try to pay attention to what's going on. And if we need, I don't feel like we need to say anything right now in terms
I don't
of,
think we can say anything.
no,
I don't think we know enough right now to say
Right.
something.
that's,
So maybe if each of us individually could educate ourselves. And if you could send us anything you have
Yeah, feel free.
that you think we should read or see or.
feel free to share.
That would be
Yeah.
great.
I think that'd be useful for us. And then if it comes a time when we need to do something, then we can
Mhm.
we can call a meeting anytime. So as you know, we've been known to call meetings at very short periods of time.
Mhm.
We used to have them every 2 weeks. Remember that? Yes. During COVID, we had meetings every 2 weeks, so. So we can, but I do think something we need to keep a close eye on. I agree. Anything else about this anybody on the board wants to say?
It sounds like we have some homework.
It sounds like it. Thank you all for bringing that to our attention and coming.
I appreciate the discussion, so thanks for taking our input.
Okay, so, all right. Moving on, election of officers. This is a new year.
No.
Anybody dying to be president or vice president? George turned me down.
Mhm.
Okay, Steve has agreed to continue being vice president. I've agreed to continue to be president for the moment, unless someone else is dying to be it, if somebody's dying to do it. Time to step in.
We do appreciate you and Steve doing
We feel
it.
that- And we do appreciate you. Do we just have the two officers? Do we
Yes,
just have
that's all we
presidents?
have
Okay.
So I guess, do we actually have to, officially do it?
I do believe at the
We-
beginning of each year,
We
yes.
have to officially, so someone needs to nominate somebody and then we need to vote.
I do believe at the beginning of the year, it needs to be official in that process.
I nominate Dr. Carol Zarukian to be our new president for the next year.
I second.
I second.
Okay, so I guess we have to vote on that? Is that how we have to do this?
Probably.
Can we
Because
vote
it's a
on Steve? Can
hybrid
we vote on
meeting.
Steve and I together? Or do we have?
You can
can do
have a
them
whole
together.
slate and vote once.
Okay,
Okay.
so I guess someone needs to nominate Steve now too.
I nominate Steve Pritchard to be the vice president.
And we'll need a second. Okay,
Second,
all right. So now we need to vote. So,
Did they vote first? Like we did
okay,
before?
okay, we're voting.
yes,
Steve. Don,
Yes.
Bob,
Yes.
George,
Yes.
Sarah,
Yes.
and I guess I have to say yes. I could abstain, I suppose, but I'll say yes.
Good quality, good quality.
Okay, so we have officers for the year.
That's what you get for doing such a good job.
Yeah, I'll try to get over that. Okay, so I guess our meeting, is there anything else? Or can I have a motion to adjourn the meeting?
I move to adjourn.
Second, anybody want a second?
Okay.
Thanks, Bob.
Second.
Okay. And that meeting's adjourned.
Good job. A lot of work planned up coming in.
Thank you.
Okay, thank you. So everybody,
Public, yeah.
How are we gonna get copies?
Nice to have the public forum.
Oh, yeah. Nothing you wanted
Do we
to-
have copies?
Putting around now.
if you go into Google and say Indiana Senate Bill 4. then you'll get it.
We're just gonna be-
We've had a lot of emails.
Yes, for sure.
This has been fun.
Yeah, kind of back and forth. And, okay, we did the paper, that's it, we're- yeah.
That's a good question.
Yeah, pretty much.
Yeah. Yes, we did. I leave except for you and the board.
There is no standing health committee.
Bye, guys. Bye.
Okay. Move on.
There used to be.
Another meeting.
Of course.
Thank you for.
Thank
you. That's right there. Thank you.
No, I think it's mostly. just-
It's good meeting. Thank you. Good meeting. You got a lot of attention.
Do you mean to say take-
Nope. Yeah. Yes. 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 I can't.
Well, no, it's sort of been, which is really-